Hi, welcome to this edition of Health Feed. I'm Katie Wick, your host. Today we have Dr. Jennifer Tingley, our Chief Medical Officer with Falls Community Health with us today. We're going to talk about some respiratory illness. It's that time of year to kind of really dive in and figure out what's going on out there, all the different viruses. We have a lot of new things and some old things that we can discuss. So welcome. Thank you for joining us, Dr. Tingley.
Thank you for having me.
So let's just go through some of the big ones that are out there right now. Obviously, this is influenza, time of year where influenza starts. We also still have COVID.
Yeah.
And we have another thing that's really kind of emerged right now is RSV.
Yes. Yep.
So let's break those down a little bit. Let's start with influenza.
Okay.
That's been around a long time. We kind of know about that.
And we know that that's a very seasonal illness. It's something that typically will start affecting us late fall into the winter and kind of in through early spring. We know that this happens every single year. This is when we start making our big push for get your flu shot. And the one thing that I just want to clarify with influenza is I think sometimes people think that that's like the stomach flu or a bug. When we're talking about influenza, we're talking about more of a respiratory illness. I mean, this causes pretty bad cough, body aches, really high fevers, headaches, and tends to last much longer than the typical stomach flu. Yep.
Okay, so influenza, some of those signs will mimic COVID that we've heard about as well. So talk to us, is COVID still around? Are we still having to worry about that?
Yeah, unfortunately, yes. COVID never really went away, and COVID is a pretty shifty illness. It kind of keeps changing just a little bit. So when you hear about these different variants that are coming forth, we are seeing some newer variants of COVID, but the symptoms match very, very well. I mean, I tend to tell my patients, if you have a cough, if you have a sore throat, if you have a headache, we're going to test you for all of it because it is pretty hard to distinguish between influenza, actually RSV, and COVID. The newer variant of COVID, I am hearing that the sore throat tends to be kind of that feature that most people will have is a pretty severe sore throat, but obviously that could be strep throat. So I mean, there are reasons to visit your medical provider so that we can really make sure we know what exactly a person has.
Okay, and then there's RSV.
Yeah.
So that's another respiratory, again, some of the same symptoms, but tell us how that differs just a tad.
Yep, so RSV is a very common virus that tends to, we think of it more in young kids, babies, but it is usually very seasonal as well. We'll tend to see this in the late fall, winter, early spring. What we're finding right now is that there's been a real high uptick of RSV cases, and it's a little bit early in the year, so that is making the news quite a bit, is that there's been this influx of RSV. The one thing that I often will think about, though, is we are testing now. When people come in sick to the clinic, we do tests that actually check for RSV, influenza, and COVID all at the same time. So I do think we're seeing a higher percentage of RSV cases because we're actually testing adults for it now, whereas we never really used to. We think of it as more a kid's illness. And it can be really serious in kids. I mean, we see a lot of babies in the hospital, young children in the hospital with RSV illnesses. They just have a really hard time breathing. Whereas an adult that gets RSV, it feels more just like the common cold.
Okay, so with all of those kind of having the same symptoms, if someone gets influenza, for example, or COVID, talk a little bit about the treatment for all three of those.
Right. So there are some antiviral medications that can be given for influenza, for example, and there are also some treatments out there for COVID, and that is something that would have to be directed by your medical provider, and a lot of times it's just helping shorten the course of that illness. If you have a virus, your body just kind of has to work through it, but we do try and minimize the severity of it, and especially in patients that are older or that have some chronic underlying conditions, diabetes, currently being treated for cancer, and actually just, like being over the age of 65, it's a much higher risk if you have influenza or COVID. We would want to do those antiviral treatments. If somebody has RSV, especially if you're just the adult with RSV, it's, well, we're just going to treat your symptoms, maybe some cough drops, cough syrups, things like that. For children that are in the hospital, there are obviously specialized breathing treatments that help them, but there's no antiviral that's going to make RSV go away faster. A little bit different than influenza or COVID.
So there's some treatments for them. Many people get over on their own.
Yep.
Give us some examples of a time where you would need to seek medical treatment
Right.
for any one of these?
For any of those,
respiratory?
yeah, no, it's a good question. I mean, I think if you're running high temperatures, anything 100.5 degrees and higher would be considered a fever. If you've been running fevers for 3-4 days, I would definitely say that's worth seeking attention. Now, we do tell people at the first sign of illness, though, it's a good idea to test, and because we do want to catch COVID early. We want to catch influenza early because that's when those treatments are actually useful. But if you're having a hard time breathing, that's a very important time to seek out medical care. We want to make sure that you don't need support in the hospital to help you breathe. And that would be, the times that I'd say difficulty breathing, high fevers for a certain number of days. And if you are having any GI or stomach symptoms, if you're not able to keep down fluids, that's a time to seek out medical help as well.
Okay, and let's talk a little bit about testing. Now we know that for COVID, there's been some home test kits that have been available. We do have those at Falls Community Health for people to pick up.
Yep.
So talk about influenza or RSV. Is there any home kits available for any of that?
Not that they're readily available. Really, the home tests we think of, that's just a test for COVID. When you do come to the clinic, most clinics and laboratories are going to be doing what we call the quad test, which is 4 different tests in the same swab. And the 4 things they're looking for: COVID, RSV, and then influenza A and B. But yeah, in terms of testing at home, what we're looking for is COVID. And it is important, like I said, if you're having any symptoms of a cold, any respiratory symptoms, go ahead and test, because we definitely don't want people going to work or school if they have COVID. That would be a risk to other people as well.
Okay, that's some great information. When we come back, we're going to talk a little bit about some prevention efforts.
Hi, I'm Dr. Swedzinski with Falls Community Health, here today to talk about influenza. Influenza is a virus that causes cough, fevers, sore throat, and body aches. It can be especially dangerous and life-threatening, especially for young children, the elderly, and people with certain health conditions. It's not too late to get a flu shot. Remember to cover your cough and wash hands frequently to prevent the spread of the virus. If you have any questions about influenza, contact your physician or Falls Community Health.
Welcome back to this edition of Health Feed. We are here with Dr. Jennifer Tingley from Falls Community Health, talking about respiratory illness for the fall and winter seasons. It happens every year.
Yep.
So, so we're talking about COVID, flu, influenza, and RSV, those upper respiratory illnesses.
Yep.
And so let's talk about some prevention efforts in order to help us stave off some of this so we don't get sick. We hear a lot about vaccines. We've had influenza vaccine around for a long time. Now we have COVID vaccines. So talk to us a little bit first about the influenza vaccine. Tell us about how that's going this year.
Yep, so that, again, like you said, that vaccine has been around for a very, very long time. This is a big push that we do in the fall and the winter, is to get your flu shot. And again, it is to help hopefully prevent you from catching influenza. The other thing I tell patients is you may still get influenza, but usually those symptoms are much more mild if you have been vaccinated. And I think it's really important this year to kind of hit on the need to get that vaccine. Our influenza numbers were down the last couple of years. I think because most of us, we were not maybe being at work as much. We were working from home. I know our kids were not in school as much. So there hasn't been that exposure to influenza in the same way that there usually is. People weren't gathering in big groups. And so I really am trying to encourage patients, especially if they haven't gotten their flu shot the last couple of years, let's get back on track, let's get that going, because you may not have been exposed to it much in the last couple of years. So that's a big one. Come springtime, we usually aren't going to be pushing flu shots for most people. There are some groups that would still benefit from it, but really the time to get it is now.
Okay, and then COVID vaccines. So there's been a little change in that. COVID, we have some boosters out.
Yes.
Explain that a little bit to us.
Yes. So, when COVID first started a couple of years ago, those vaccines that were created were kind of in response to those variants that were happening. And we have certainly seen a shift in the way that virus looks and acts. And so what we're doing now is we're providing a newer booster that's called a bivalent booster. And so what that has is causes some protection against those original older variants, as well as some protection against those newer variants, which really started up kind of last December, January. We started to see climbs in the summer, this past summer, of these new variants. And so that bivalent booster is really important for people to get, because it is going to give you that protection against what we're currently seeing now. And even if you've gotten your first 2 COVID shots a year or 2 years ago, and maybe even had gotten the original booster, we still want people to get that bivalent booster. That's a really important point to know, is if you haven't had the bivalent, and that's how it would be described, we want to make sure that you're getting boosted with that particular vaccine.
Because it matches a little bit better
Yes.
to what is circulating out there in
That's
the public.
right.
Okay.
Yep. It's matching these newer variants, which sometimes the terminology gets a little confusing, but we've been calling it BA4 and BA5. We know that the new bivalent booster is offering some protection against those variants.
Okay, so we have influenza and COVID. Can we get those shots together?
You sure can. Yep. Say one in each arm. Your arms might be a little bit sore, but it is absolutely safe to get both vaccines same day, same time.
Okay.
Yep.
So what about RSV?
Yeah, unfortunately, there aren't vaccines for RSV. For little teeny tiny babies, yes, there are. But for the general population, there isn't a vaccine against RSV. It is one of those things, you've probably been exposed to it, you've probably had it, you didn't really know. But that's where just the general common preventative practices come into play there, which is, cover your nose and your mouth if you're sneezing, make sure you're washing your hands or using hand sanitizer, trying to avoid those big crowded places where lots of people are. That will be the one thing that's going to help you not come into contact with RSV.
Right. So if we've had either influenza or COVID, how long would you need to wait to get because it would still be beneficial if there's a different strain of influenza coming down the pike, or the variants aren't, you had a different variant, it's still beneficial to get those if you've already had the...
That's absolutely true. And I'll start with influenza because we do know that there are different variants of influenza. So if I got influenza this month, I would still want to get my vaccine, in a couple weeks. You can actually get that vaccine soon after you feel better from your influenza illness. You can get that flu shot anytime, because we know that earlier in flu season we tend to see one variant. It will start to shift, and we'll start to see patients that test positive for both influenza A and B. That's just kind of bad luck, but it can happen. And so we definitely want to vaccinate at any point. Now with COVID, the guidance has said you could wait, if you had a COVID infection, you could wait up to 3 months before getting that booster shot, and that would be fine. There is no strict rule though, so if I had COVID today and I wanted to get my booster in a month, that would be fine as well. But you can wait up to 3 months. You have some natural immunity at that point. So that's kind of what we say for boosters. Definitely just talk to your medical provider, call your clinic. They would be more than happy to give you guidance on when the right time would be for you to get that vaccine.
Okay, so you mentioned a little bit about some prevention efforts with RSV. So let's talk about that again. We have the holiday season coming up. There will be a lot of gatherings. People may have not gathered in the last couple of years with friends or family. Talk to us just about some safety things that we can just always keep in mind when we're getting ready to go to a big gathering or a holiday party or something.
And I think the one thing to point out is, this became so much more important with COVID, but actually these practices work just as well with influenza, with RSV, actually any illness in general. Is, if you're going to be gathering in large groups, that risk is there. It's possible that somebody is sick in that room or that living room, and you may come into contact with that. So we always tell people, if you are not feeling well, don't go to the family gathering, don't go to the big concert, just stay home. Kind of think of the people around you and keeping them safe. The same for work. If you're feeling sick, certainly if you have fever, we do not want people to be going to work at that time. It's just really important to kind of slow down the spread by not being around people that are sick. So that's a big key, is just to, if you're sick, don't attend the big family gathering. You know, call your supervisor. It might be best that you stay home. Yes, yes, exactly. Yep. And then, like I had said, you know, making sure that we're always washing our hands, especially if you're coming into contact with a lot of people, if you've been shaking hands, if you're opening a ton of doorknobs. Hand hygiene is always important. Hand sanitizer. And I always tell my kids, make sure before you eat any meal, any snack, wash your hands. I don't care what you've been doing, just wash your hands, because it's not just flu, COVID, it's everything else. We don't want any bugs being just easily brought into our body. So, yep.
Okay, well, we appreciate all of your information and tips, and we want everybody to stay as healthy as possible over the next few months as they're gathering together and we're getting back to some normalcy.
Yes.
All right.
Thanks, Katie.
Thank you. If you would like to stop by Falls Community Health to pick up a free home COVID test, you can do that during business hours. Our address is 521 North Main. Or if you'd like to call to schedule your COVID or influenza vaccine, you can do that by calling 605-367-8793. Thank you for joining us today.